This tool is one of several resources available for children and young people's mental health commissioners and is supported by NHS England's Mental Health Clinical Policy and Strategy team. You can request information on the wider Commissioner Support Programme via the email address displayed on the screen here. This video will take you through some of the next steps to take with your modelling once you have created your first intention and collaboration. It will cover some of the functions available to admin users, along with some of the more advanced features of the community and inpatient tools. The first portion of the video will focus on the community tool. The inpatient tool will be covered later on in the video. To begin with, we'll look at some of the features available to admin users. If you have administrator permissions on your account, you will have access to the admin menu within the tool, allowing you to manage users and edit some of the default system settings, such as staff costings and some of your service settings. To add a new user, please click on the Users button and press New. Enter the user's email address and name and tick the relevant boxes. If the user requires administrator access, please tick the administrator box. Any user who will be entering or editing data will need to have the editor box ticked. And lastly, please tick the active box to indicate the user's account is currently in use. This can be changed to inactive if the user no longer needs access to the tool. Press save and this will send an email to the user containing their login details and a link to the tool. User accounts can be edited by clicking on the email address and changing the permissions accordingly. You can also delete a user by pressing the delete button, which will remove their access completely. The Community Preferences section allows you to default which care model you wish to use, as well as what the average length of contact you're anticipating is at those care levels. If you have a local model you wish to reference, you can specify that here and update the period of contact if required. Any of these boxes can be changed with your own settings. You can then select which care model you wish to use by using this drop-down box here. The Community Cost section is where you will find the staff costing values that will be used across your services. If you don't want to use the system default values, you can create your own reference costs. Click on the system setting and then press New. This will create the new set of costings for you. Click on this, give the costing a name and year, and select the resource you wish to amend. You can then enter your own values into these boxes and press save. You will then be able to reference your new costing values when using other areas of the tool. The inpatient tool also allows you to manage users and edit costing values in the same way. We'll now look at the tool itself, starting with the Intentions Manager. Select the intention you have already saved. This will bring up the data you have previously entered. The Future Changes tab helps the user to consider and record whether they wish to shift aspects of care between various locations or levels, such as from health settings to educational settings, and also allows you to model shifts from inpatient to community-based services. The initial activity figures populated at the top of the page come from the baseline created in your historic activity. These figures are the ones you will be modifying in the subsequent fields of this dialog. There are two sections to this area: community shifts and inpatient shifts. To add an activity shift, press the Add Adjustment button, select the source of the activity and where you wish to shift it to, enter the number of cases you want to shift and any additional details if required, and press save. Any changes made will be reflected in the totals at the bottom of the page. Any adjustments you have made will be shown over here. So you can see we have shifted some activity from education to non-health and also from non-health to targeted. The Inpatient Shifts tab functions in the same way, allowing you to shift activity from inpatient services to community services. As before, press Add Adjustment, select your source and where you will be shifting to, and enter the quantity of cases you are shifting. We'll now look at taking your collaboration further. Where part of your population naturally gravitate towards services of a neighbouring area, you may have arrangements that they will commission the activity on your behalf. The Sharing tab is where these arrangements can be modelled into your planning. The tab has two primary functions: importing and exporting activity. Adding an export or an import will bring up a list of collaborators that your area is currently working with. To import or export activity, click on the relevant button. Select the organization you wish to collaborate with. Enter the amount of activity for each area that you wish to shift. Press Save. The total activity figures at the bottom of the page will update to reflect the shifted activity you have entered. The final area of the community tool you may wish to use is the What If tab. This is available in both the community and inpatient tools. We'll look at the community tool first and cover the inpatient version later on in the video. The purpose of this stage of the tool is to help you answer some fundamental questions about the service you are trying to commission, such as, what is the cost per patient? What would the average weight be? What is my utilization? This part of the tool is your sandbox in which you can play with specified and optimized services in order to compare all outputs. Begin by selecting one of your services. The inputs are copied to the settings area for you to view. The specified and optimized lines let you play with these inputs without affecting your defined service. The analysis is shown for you to compare these in the bottom section. If you want to optimize a service, look at the optimized line. You can enter the proportion of patients who need to be seen within the waiting limit, say 98%, and what the maximum waiting limit is in days. We'll leave that at 10 days. If you recalculate, the tool will then tell you how many appointments you need per week to meet this threshold. So in order to meet this demand, we would need to make 21 appointments available per week. One scenario you may wish to plan for is the event of a crisis point where you will effectively have a waiting time of 0. We can change the waiting limit to 0 and recalculate to see the impact this will have and the resources that will need to be made available. Once you have optimized your service, you can then press the Edit button and update your service in order to match your optimization results. We will now take a look at the more advanced features of the inpatient tool. A lot of these areas serve the same purpose as the community tool, but function slightly differently. Looking at the intention manager first, we'll now cover some of the more advanced features available to you here. The intention manager allows you to import or export activity, as well as shifting activity from inpatient to community settings. The Exported tab allows you to transfer a proportion of your locally generated activity to specified alternative regions if needed. Click on Add and select the region you will be exporting activity to. Enter the number of cases in each category you wish to export and press Save. The numbers in the running totals at the bottom of the page will reflect these adjustments. Likewise, the Imported tab allows you to deal with activity you anticipate neighbouring regions wanting to send to you. As before, click on the Add button to add your imported activity. Select the region, as before, and specify the anticipated number of cases, and press Save. This will again update as before in the total activity figures at the bottom. Alternatively, if another region has added a set of exported activity designated for your region, you can load this by pressing the Load Published button. This will import the data for you without having to manually add it. The Shift to Community tab allows you to deal with activity you anticipate shifting out to community providers, and also activity other regions intend on exporting to you. Adding a shift to community settings can be done by clicking on the Add button and selecting the organization you anticipate shifting to. Enter the quantity of activity to shift and press Save. Again, if another region has opted to export activity to your region, you can import this by using the Load Published button. We'll now look at the Collaborations Manager. The Inpatient Collaborations Manager includes data for every provider in England and lists the providers for your region on the Providers tab. You can add, edit or delete providers by pressing the New Provider button or by clicking on the provider name in the list below. For each provider, you can record the provider name, the provider code, bed numbers for each of the mental health categories, and the average length of stay. Press Save and you will see your new provider appear in the list. The What If page functions in a similar way to the Community tool. This part of the tool acts as your sandbox where you can play with specified and optimized services in order to compare all outputs. Select the condition you wish to analyse. The page will display the activity you have specified in the earlier tabs and the total resources available to deal with them. The tool will display the average wait time, the potential number of patients who would breach the maximum wait, the estimated costs, and also the resource utilization rate. If you want to optimize a service, you can use the Optimize line. The tool will then tell you how many beds you need to meet this criteria, along with showing you the estimated costs and utilization rate at the bottom of the page. Once you are happy with your optimized service, you can then go back and edit it accordingly. Hopefully this has helped explain some of the more advanced features of the tool, but if you do have any questions, please do get in touch with our support team at cypmh.model@nhs.net.